Hello fellow classmates, my name is Shay. I will be presenting to you today a condition of the musculoskeletal system. I chose to do my oral presentation on osteoarthritis. This is what a regular knee joint would look like, and this is what a joint would look like with osteoarthritis. The etiology of osteoarthritis is the breaking down of cartilage over time and the overall change to the joint. Physical characteristics and attributions can be seen as bony spurs, a lack of a synovial fluid going in between here, and an overall deterioration of the cartilage of the joint. In regards to instances of osteoarthritis, 32.5 million US adults suffer from osteoarthritis. In regards to prevalence, it is most common in the age groups between 40 to 60 years old, being the most likely 50 years and older, specifically in women who have passed menopause. Osteoarthritis is a disease of the entire joint sparing no tissue. Mechanical stress as well as abnormal joint mechanics will lead to joint destruction over time. The first sign and symptom to be wary of when it comes to osteoarthritis is arthralgia. It can worsen with activity and feel better in early stages with rest. The next symptom would be arthrostasis, which can follow periods of long rest. A lot of people with osteoarthritis have noted that when they wake up in the morning, the first 30 minutes they will feel swelling and uncomfortability until they can work their muscles and joints out. Next, mild joint inflammations will cause swelling where soft tissue can be irritated around the surrounding areas. A decreased range of motion can also be expected due to tightness in the joints from the shifting of the cartilage. An audio indicator of osteoarthritis is crepitus, which is a grating sound when moving the joints back and forth. In later stages of osteoarthritis, you can also expect to see joint deformity in the form of bone spurs. All of these symptoms can also lead to an instability of the joints, which will inhibit the way you are able to function and move your body. With all these joints set in mind, and the irritations, inflammations, swelling, there will also be tenderness around the joints that are affected by osteoarthritis. The most commonly affected joints are going to be the tibiofemoral joint, the acetobulofemoral joint, all the joints of the hand, as well as the neck, spine, and lower back. Back to this diagram here, it is not as common to see osteoarthritis in the 40 age group, but this can be caused by obesity, joint injuries, repetitive joint stress, or potentially genetic conditions. It is most commonly seen in the 50 and upward range. It is specifically more common, as you can see, in women, specifically postmenopause. In the 60 plus range, it is also more commonly seen, specifically in x-rays, where not a lot of people will report the typical signs and symptoms we just discussed, but it will still show up in their x-rays. Medical and surgical treatment for osteoarthritis involves three things. First up is relieving the symptoms already present, improving joint function, and attempting to slow down the progression of osteoarthritis. The first medical treatment available for osteoarthritis is taking Tylenol or ibuprofen to relieve the arthritis. The next treatment available medically wise is topical treatments. A specific example I was able to find is capsaicin cream. You can massage this onto the joints to help relieve knee pain, arthritis, neuropathy pain, sore muscles, overall pain relief, knee pain, leg pain, essentially rubbing it on the joints to relieve some of the pain and stress from osteoarthritis. The next available option is a corticosteroid treatment, which would help reduce inflammation and pain within the joints. Similarly, another injection available is hyaluronic acid. This is typically used to mimic the synovial joint fluid that tends to erode over time with later set osteoarthritis cases. That is when the synovial joint fluid wears down, so doing these injections can help replace that lubricant so that you can feel relief with the joints rubbing on each other. A very common physical therapy option that is also available is low-impact sports to strengthen the joints and muscles. The purpose of this is to strengthen the joints without creating more strain on them so that they're deteriorating more. A good example of this is water aerobics, which I actually used to teach when I was a lifeguard a few years ago, and it was very fun. Other examples are also yoga, jogging, stretching, things of that nature. Exercises like these can strengthen the muscle around the joints to help mitigate against the instability that can be caused by osteoarthritis. It can also help to improve the range of motion being restored back to your body, balance, as well as flexibility. Certain lifestyle modifications may also be expected to be changed if you have osteoarthritis, one of them being weight loss. If you are overweight, it is putting more stress on your already deteriorating joints and cartilage. This is important because it would reduce joint stress to your body. Other lifestyle modifications may include needing to walk with a cane to help relieve the stress on your joint, as well as braces, as well as other orthotics. A lot of these tools are very helpful in mitigating the stress to the joints that people who have symptoms of osteoarthritis are suffering with. An alternative therapy for osteoarthritis is also acupuncture, which can mitigate the inflammation of your joints. The first surgical treatment that is going to be available for osteoarthritis is going to be arthroscopy. Arthroscopy is minimally invasive, removes loose cartilage and bone fragments from the tissues. The next surgery available is going to be an osteotomy. This is going to be a bone realignment surgery that helps to shift the weight off of the damaged joint. This procedure is typically used in younger patients who have early osteoarthritis. This procedure involves removing a wedge of the bone to help correct it to a more comfortable position for the patient. Next is going to be a joint replacement surgery, also known as arthroplasty. This is where the original joint is removed and an artificial joint is put in place. This is the most common and most effective surgery option. The most common site that this procedure will be done is going to be the shoulder, the hip, or the knee, not so much in the hands or the wrist. It's mostly the big movers. The next surgery available is going to be arthrodesis. This surgery fuses the bone together to eliminate movement. This is used more commonly in the smaller joints, such as you can see on the foot, also in the wrist and the ankle. Post-surgery, if these surgeries are successful, a lot of patients will gain near normal joint function, as well as major joint relief. The prognosis of osteoarthritis is dependent on several factors. One being what joints are specifically affected. Two being the severity of the disease, the age of the patient seeking care, as well as the overall health of the patient, and 5, how early the treatment begins. The first general outlook of osteoarthritis would be chronic and progressive. This is meaning that it will not go away and it will only get worse with time. The next outlook is that though this is not a life-threatening condition, it can severely affect the quality of life of the patient. If caught in the early stages, a lot of patients with osteoarthritis can live happy, active lives. It all comes down to a manner of managing your symptoms, and this can have a difference in between living happily for decades and living in pain. The favorable prognosis consists of the following: an early diagnosis and treatment being started, staying physically active and maintaining a healthy weight, mild to moderate joint involvement, meaning that it hasn't taken over all the joints of your body but tends to stay localized if caught early. If your body has a good response to medications and treatments and therapies available, then that is also great. On the flip side, the non-favorable prognoses are as follows: severe joint damage at the point of diagnosis, meaning the patient let it get so bad to the point of already experiencing the pain that it is going to be to a state where you can't backtrack to correct, but only move forward with the pain you have now and try to mitigate the damages from spreading. If multiple joints are affected, inactivity or obesity causing more strain to the joints to further along the symptoms, or a delay in treatment or poor access to care. In learning about this condition, one thing that is abundantly clear to me is in your early stages, you need to take care of yourself, take care of your health, take your body seriously, and really try to put your best foot forward in caring for yourself and your body overall. Making sure that you're taking care of yourself now in your body and putting in the work to strengthen your foundation, because these will be the bones and joints that carry you through the rest of your life. Also keeping an eye out for the signs and symptoms as they do come up with age, because it is a very common disease, just to make sure you can start getting the therapies, medications, and treatments in place early so that you can live a more happy, healthy life. Thank you so much for listening to my awkward oral presentation. I appreciate it very much, and I look forward to seeing your guys' responses as well. Thank you!